everyone, and welcome to another episode of How I Got into PT School. We're joined today by a very special guest, Devon Johnson. Devon, how are you doing today?
I'm doing pretty good. Thanks for having me on today.
I see you're joining us from your very luscious sunning room.
Yeah, I grow lots of plants here. My hands kind of disappear. For those that can see this video. Yeah.
Devon, now you're a special guest in the sense that you're not a PT student or a physical therapist. Can you tell us what you do?
Yeah, that's right. So I'm a medical student. I'm in my fourth year. I uh, didn't originally know I was going to go into medicine, and I had considered different pathways, including like PA, PT. Um, but I ended up deciding to go to med school, and it's a little bit different from your standard guest, I suppose.
Yeah, and that's good because I know some people, right? You're thinking about, well, what path do I want to go down? Hopefully, this episode, what you can really take away from it is different considerations, right? Like what might make you lean towards one profession or another. So we'll just get into the interview, and that way everyone can get an idea of who you are and perhaps what field they want to dive into. So Devin, tell us, where are you from?
From Ukiah, which is a small rural area in Northern California. Um, my specific house is kind of far in the mountains, but it's a fairly small town area, and you're very familiar with it, I know. But many other people won't be. A lot of vineyards, mountains, redwood trees, etc.
Yeah, and you're
Really one main high school.
Yeah, your house in particular, you kind of obviously is a very rural area, but your house in particular is the rural part of the rural town. So if anyone's familiar with like that disparity between having access to healthcare professionals, it'd likely be you.
Yeah, it's pretty far out there in the middle of nowhere. The nearest neighbor is about a half mile to a mile away, so pretty out there.
And so we kind of got into this, but there's only one high school. So can you tell us a little bit about what your schooling was like prior to college?
Yeah, absolutely. So, um, went to Ukiah High, the main high school, um, and somewhere between like 1,300 people in the high school. It had certain things. It had certain AP classes available. Not as many as most places, and those AP classes would fill up pretty quickly, so not everyone was able to get them. It's considered a disadvantaged area with greater than 50% of the students uh, receiving aid for lunches. But I really enjoyed going to high school there. I made really good friends, and I prioritized schoolwork.
Yeah, and so yeah, this area that you grew up in, obviously not as there's not like an abundance of things around to do. In your high school career, can you tell us a little bit about? Did you play sports, or were you part of any clubs? Did they have that available at your school?
Yeah, sure. So, really, just growing up, I was always in some sort of sport. I must have played about 6 or 7 years of soccer, and then like maybe 5 years of baseball, even a year of football. But I was never um, never had like a lot of athletic prowess. Coming to high school, not a huge athlete, I ended up playing tennis. Um, which was a sport that pretty much anyone can get into. And started off, I did like 4 years of that, as well as maybe a year of wrestling. I was never very good at that though. But I think that did help with my applications in the future, both to undergrad and then and following.
Right. So it kind of showed that you have this diverse collection of experiences that you could draw upon for, of course, like essay topics, but just referring to any aspect of life, I suppose.
Yeah, most interviews they'll ask various questions about extracurricular things that you like to do, or really things that are non-academic, and you want to have something that you're able to tell them. Sports are obviously an incredibly good one. It's very societally acceptable to play a sport, and the reasons are it's like it's great for your health, obviously, like teamwork. It'll be interesting in the coming few years that may become a little bit more relaxed with COVID, due to many of the high school sports having to take a little pause. But when I was in high school, um, yeah, I was able to be on that tennis team. I worked my way up and ended up getting MVP number one seat on the varsity team prior to graduating, and I had a great time doing it.
Yeah, and so that's important, right? So using again these experiences to kind of be able to collectively draw upon them for whatever reasons, application seasons for both undergrad and grad school. So when you're in high school, you're doing all these. You've now done a collection of different sports. And I know initially you said that you didn't know that you were going for the MD path. When did you start considering going in the medical direction as a profession?
Yeah, I have a problem. I can never really rule things out. I generally enjoy a lot of things. Even in high school, I thought I might like to be an engineer. I was good at math. I liked tinkering with things. I loved the psychology class I took, and I thought I might go into become a psychologist. And my first real introduction to the medical field happened fairly early for me with my mom getting cancer. This is a fairly common theme in the medical field with um, a lot of medical professions or professionals rather having personal experiences going into hospitals, speaking with different professionals, and kind of guiding them, like maybe showing that as an option. And I had that as well, starting from an early age. But I wasn't certain for quite a while actually, uh, even into undergrad, whether I wanted what I wanted to do.
Yeah, and so from an early age, you've been introduced now to the medical system through a very unfortunate event, a family member getting cancer, and I think that resonates, like you were saying, with a lot of medical professionals. Typically, the reason why I ask the sports question in a lot of these interviews is because, as a physical therapist, most people's introduction is I was playing a sport, I got hurt, and then I went to a PT clinic and I was like, oh my gosh, this is what I want to do. So it sounds like some semi similar of a case in the broad scheme of things, being that you had some personal experience with the medical field that kind of helped lead you to want to consider that.
Yeah, as well as just finding myself, I like the subject. I like learning about it, and at some point you have to think about like what you like learning about is huge because you're going to be a lifelong learner in whatever professional field you go into. Um, so if you like a subject, you can go different routes. You could go like become a researcher. You could go in private industry, or you can kind of go into the broad medical field, which is there's so many different niches within that. But you're using these same like science, the same scientific foundation of like biology, chemistry, etc. Just different ways. And
Yeah,
I liked this field. I just wasn't sure which direction I wanted to go for quite a while, actually.
yeah. And that's a good point. I like that you brought that up. So someone right now who's potentially considering a lot of different career paths, it's super important that yeah you're correct in that like you're a lifelong learner. Me and Devon, we often share articles with each other. He'll send me something or I'll refer him to something, and so you're constantly just reading and learning about whatever it is that whatever your field entails. So that might be a consideration for someone who's in your case you had to do OChem, a lot of chemistry, if that's something that's biology, and if that's something you're really interested in, maybe going more towards the MD path. Whereas I was a lot more interested, I think, just in the kinesiology, more of how it applies to physical performance, and of course that led me to PT school. So Devin, so now okay, so you finished high school, and now you're going into your undergrad. Can you tell us a little about where you went, what your major was, and that experience?
Yeah, sure. So just in high school, other than the sports, I didn't have a whole lot of extracurriculars when applying for undergrad. But I did have pretty good grades, and that was really, I guess, what it took. I applied very broadly across California, outside of California, and at that point, I actually applied to different majors for different schools. I remember I applied to UCLA, for instance, as electrical engineering, and to Berkeley as psychology, and then computer science, a couple other ones. Very indecisive. I wanted to keep my options open. Um, Really, it's kind of like a theme along my life, just trying to do like prepare enough where I could divert into any direction I want to go. I ended up going to UC Berkeley with psychology, which for me it was a good decision. I didn't get into UCLA or various other schools, and I remember that's partly due to like certain majors being more difficult to get into for undergrad. And like for instance, maybe my GPA without extracurriculars wasn't good enough to get into an engineering degree. But I was able to do psychology, and then with a pre-medical pathway, really you can go in with any major, and you just have to take the prerequisite courses to go into that field. So I decided I wanted to probably go into one of the health professional fields, which requires um, certain amounts of like biology, chemistry, some math, etc., and just kind of start there along with my psychology courses at Berkeley.
Yeah, so that's good. It's very interesting that the your approach to schooling, because our first guest on this episode, he had his circumstances were obviously different, but his way of orienting himself towards his goal of obviously getting into PT school was, I need to eliminate all my other options, right? So I need to shut everything else down and then just focus on this one. Whereas you, it sounds like you weren't sure about what you're going to do, so you tried to elevate everything at once, so that at any point you could choose a different direction if you thought that was the best case. That's kind of an interesting dichotomy, I think, of mindsets.
That's right. I'm not sure which one's better. It's just what I did. So
Okay, so you've gotten into Berkeley now. So you're going in with the psychology. Is there anything that you did in Berkeley that you think perhaps that you were, I guess, with the mindset of getting into med school? Was there anything that you were doing at Berkeley that you did in order to help your application?
yeah, I want to kind of emphasize this point. My first 2 years at Berkeley, I focused mainly on getting a high GPA um, to get into medical school. That is the it's the limitation. You have to have a certain GPA, specifically a science GPA, above a certain threshold. And UC Berkeley is a public university, and they don't do as much grade inflation as some other institutions. So some of the pre-medical courses are just known to be incredibly brutal and very difficult to get good grades in. So I really devote almost all my time to school, as well as just kind of finding friends and being social. For the first 2 years, I didn't do any extracurriculars, really.
Yeah.
Um, and starting my junior year, I really started my first like extracurricular. And you need quite a few extracurriculars. There's really a checklist that you need to fulfill. And I didn't really have an application. I didn't. My CV was empty. My resume was fairly empty um, as far as meaningful clinical experiences. Um, but pretty much any hospital that you can find, especially ones near schools, will have programs set up where you can volunteer. I started there. I went in. I think my shift started at 5 a.m. I'd bike to the nearest hospital, Alta Bates, and put in 100 hours in their gift shop as a cashier before they let me go to like the surgery, like the pre and post surgery area where you kind of like do clinical care. You help the nurses out with preparing gurneys, like helping patients get in gowns and things like that. It really just like like an entry level clinical experience that I had never had until the junior year of undergrad, with a goal of potentially going to medical school, which a lot of people started their freshman year.
It's
So
a
I,
sorry,
yeah.
go ahead.
Oh, I was just gonna just say that I started late as far as extracurriculars.
Yeah, I think it's very
Early
interesting.
time.
A lot of the points that you brought up, being that it sounds like going back to Berkeley and not inflating grades. So, uh, and I've heard that too about Berkeley. They're not very forgiving when it comes to when it comes to like your grades and your GPA. They actually have, and in my understanding, is a lot of weeder courses, right? So they're trying to weed you out. And for those who don't know, weeder course, I mean, this is for someone who's an undergrad right now. When you're looking at different majors, weeder courses are the courses that I'm not going to say actively trying to fail you, but it feels like that's the case, right? They're trying to weed out the people who aren't very interested in going into that field. And so in Devon's case, yeah, in order to make sure that your GPA was, on point, because you have to have a certain GPA in science for applying to these programs, you had to go through a lot of weeder courses. So, I mean, in your case, it was prioritizing your GPA over doing the extracurriculars. So that might be a tactic for some students to take, in I think any professional field that you're looking at. If you feel like you're faced with a school like Devon, Berkeley, where they're doing a lot of weeder courses, maybe it's better to just focus on that. I know Sac State, their kinesiology program, there's like the intro courses. They don't everyone. I know the last interview I had a fellow Sac State alumni, and we were talking about how like our introduction to the program was um, having an auditorium full of people where they were basically saying everyone here needs to find a different profession because not any of you are going to be PTs, and so yeah, and so understanding that might be the mentality of the school that you're going to, and that might be the environment that you're faced with. Yeah, of course, it might not be the best in your best interest to try to knock out these extracurriculars. May take more time to focus on getting the good grades, and I think that's an important lesson, regardless of what profession you're going into. Um, yeah, and so you also you brought up a good point, which is the hours, and I know in your case, uh, working at the gift shop, right, for 100 hours, and then being able to actually do your clinical hours. That's it sounds to me like another weeder situation, right, where they're trying to weed out the people who are actually interested. Did you feel like what the hours for in your case is the same for like the Berkeley classes, right? Like they're trying to weed out the people that weren't actually truly interested in going to med school.
Yeah. So I'll take that in two parts. The certain courses like Bio 1A, they'll have a grading scheme where only 20% of the class is allowed to get A's, no matter how good the class is. So when you have a situation like this, with the majority of the people in a course like this all trying to go to a medical field, where GPA is incredibly important, and everyone knows this, but only 20% can really cut it. Uh, it breeds a mentality that is very difficult. And I'm not sure if that's the best way to have a course, but that's how it is at Berkeley. There are other courses that are traditionally weeder courses like Chem 1A and OChem. But I mean, there's so many different study groups that you can join, and then like even school sponsored study groups that you have to go into in order to pass, really. They have enough. There's enough tools to that if you take advantage of them, you can do fairly well in Berkeley. The gift shop, I think it was more of an availability thing. UC
Mm-hmm.
Berkeley's huge. It's such a there's I forget the number of people in Berkeley. It's something like 20,000. And a
Just
lot of
students,
people,
right?
yeah. And that might be with like undergrad and graduate. It's been a while since I've looked at the number, but there's so many people, and there's not a school, or there's not a hospital dedicated to UC Berkeley. The closest one that has a strong connection is UCSF, which is not very close at all. So Oakland is the next closest, and they have so many students looking for clinical experiences that they have the option of kind of giving them to the gift shop. So I mean, it's what I was given, so I took it. And it led to a lot of other things that were incredibly important for my application.
Yeah, that's a good point. And I kind of want to go back and go over this idea of classes and just discuss like some options for students who, in this case, the bio class sounds like it was one of the ones where only the top 20% can get a good grade to make them competitive on an application. I know my physics course at Sac State was one of those classes where it was not designed to pass students. It was designed to make it very difficult. Again, a weeder class. And so, me thinking about my application for grad school, I actually didn't take the physics course, the second physics course at Sac State. Instead, what I did is I went to the local junior college and took it there. And the quality of the course was way much better. I learned so much more. There was there's like 100 students in your physics course at a like a high university level, whereas at the junior college level there was 10 kids in the class, and so you get much more like intimate attention when it comes to trying to solve problems. Um, so that's an option if you have a local JC near you that's available, um, which in my case for Sac State it was. And then going to the hospital system, it sounds 20,000 students in an area. That's a lot of people to be competing against. Um, you know, Again, me and Devon. For those who haven't picked up on this, we're from the same hometown. We've known each other for a long time. So the hospital system in our hometown is severely underutilized as a resource for going and getting clinical hours. So it's very easy if you think about if you're in a city or a very high density college town, perhaps go to one of the more rural areas surrounding the town. So you're gonna have to commute, right? But it might be worth it because if you're stuck, I know one of the local systems at Sac State, you could only get in Monday for 4 hours, and then other students would come in and it'd rotate every 4 hours. And so, 4 hours once a week is not enough to really like pad your hours for clinical experience. Um, I was working 40-hour weeks, when I was doing nothing but doing internships. I would just go and shadow for 40 hours a week, and so very quickly you could accumulate the hours that you needed um, for your application. So I just wanted to highlight some options, right, as solutions to these problems. Okay, so Devin, so now you're at Berkeley. You've got your hours down. Uh, you're starting to collect hours for med school. Can you walk us through about your experience with thinking about med school and maybe look what your GPA and MCAT score, like what those numbers look like?
Sure. So, for those that don't know, MCAT's the entrance exam for medical school. It's just like the GRE, except specific to med school, MD and DO schools. And the GPA is a limiting factor, as I said. My GPA was not fantastic. I had an exceptionally low GPA for getting into medical school. Really, the only saving grace was that the psychology courses that I took really padded my GPA, gave me. I was able to. They're much easier. Took quite a bit less work to get high grades in. They were less competitive. The same people that were in the Bio 1A and organic chemistry courses were often also going into molecular and cell biology, different courses, so different competition. So I took these courses to kind of pad my GPA, and overall, my I believe my GPA was like a 3.43 with my psych, and then with my like just science GPA it was something like a 3.2, which for a lot of people would sound pretty good, but for not for medicine. Generally, you'll go on like student doctor and it'll say like 3.5 minimum for any university. But luckily, it's not the only thing that they look at. They look at your MCAT, your scores. This is something I did exceptionally well on. It was in the top 5% for MCAT. So I was luckily, like, my GPA was so low, but then my MCAT kind of saved me. And I didn't just take it once, I took it twice. And I took an MCAT prep course that I threw down a couple $1,000 in loans for. But it was obviously worth it because it did the trick. it's such an important exam that I can't emphasize that enough. And I wasn't someone that could really study on my own. I tried starting to study on my own, but having a preparatory course that really, it was 6 days a week. I did it through the Berkeley Review, which is this agency right next to UC Berkeley, and it was just incredibly in depth. I thought they prepared me very well. I took the MCAT. I didn't do great, and then I waited, and then I studied and retook it again, and I did do great.
How long was it between the first MCAT and the second? How long did you take to study and then retake it?
Oh, about about a year, about a year and a half actually. Um, Actually 1 year I think. There were like personal reasons why the first MCAT wasn't great. Like it was really, my mom was getting pretty sick, and she died, which is something. It's just a horrible experience, you know. Um, and then I had my MCAT scheduled for the month after that.
Right. So nowhere is your mind focused on, especially going through something like that. Nowhere is your mind focused on actually doing the MCAT. You know.
And in this like days, I don't know why I thought I had studied enough previously that I would just go into this incredibly long, I think it's like 8 hours, like test, and then I would just be able to stay like lightning focused. No, absolutely not. Like I wasn't real with myself. I took it anyway. My score was not as high as my practice scores that I had taken months previous, um, during a different time, right? So it kind of broke me down for a little bit. You need a certain number of things on your checklist in order to apply to medical school, right? And the GPA, you need 3.5, I was told. I had a 3.3. You need certain amount of extracurriculars, which I was, at this point I was accumulating that volunteer work that I did at the hospital kind of rolled into other clinical work that became increasingly more important and really impactful, and led to leadership positions. So I had that, but then the MCAT, which is one of the most important things as well, I kind of paused. I graduated at this point, and I was like, what do I want to do? Like this is a point where I probably wouldn't get into medical school if I applied right now. Do I want to apply to a different health professional field? Which one? Like, I'm not sure. Like, I at this point I decided that I really wanted to go to medical school for very specific reasons. But there's advantages to quite a few different other professions. At this point, I was thinking PA versus nurse practitioner, as well. These are 3-year programs generally that that are very similar to what an MD or a DO does, with shorter programs. But there are trade-offs, and I was kind of weighing these things. I was thinking about life, and while I was doing this, I was continually getting more clinical experience. I just, in the background, getting more like job experience, more hours. I was working as a health coach, just like telling people what their lipid tests meant, and doing like vitals and stuff.
Yeah.
And yeah, and I went from there. I retook uh, a Bio 1A course at a junior college, or a community college, and did really well. Got a great letter of recommendation. And it almost felt like cheating because I'd already taken this course
Right.
at Berkeley, but like my grade on it wasn't stellar. It was like my weak point, and I'm trying to restudy for the MCAT, and I'd already paid like $2,000 for this MCAT review course that I don't want to pay another 2,000. So I just signed up for a community college course in biology, which is the main portion of the MCAT really, and I studied concurrently, um, which led me to do really well in the class, of course, but also it was the fire that let me restart my studying for the MCAT and take that again.
Yeah, so there's a lot to unpack there. And I'd like to kind of start by just getting like a really overview message of what your experience was like post graduation and applying or starting the process of applying to med school. And it's a theme that I think some of you who have watched a lot of these episodes, it's a theme that kind of resonates with a lot of different people, which is the persistence and then not giving up, right? Um, not allowing something that is an obstacle prevent you from continuing. And so in Devon's case, absolutely traumatic life event, arguably one of the most traumatic, right? And losing a family member, and of course, right after that, you're taking this very determining exam for what your career is going to be, and then getting a low score. And what I want everyone to hopefully take away from this is that those things don't um, determine what your future ability to get into these schools are. So in Devon's case, absolutely traumatic event, low scores, but keeps going, right? This steadiness of like, well, okay, it's not obviously the MCAT is not what I wanted it to be, but I'm going to retake this class. I'm going to keep gaining clinical experience, and of course, all that ends up leading into this great MCAT score. So it's the persistence is like the substance of character that I'm sure you probably spoke about this. I'm sure I actually don't know when you were applying to med school. They have essays. I'm sure that you have to write about yourself. So I'm sure was that I would imagine a lot of substance for your essays is speaking about all this experience up until the application process.
Yeah, I include certain things, and even there is a little portion for like in some of the applications, for instance, at UC Davis, where I go to school, they had a little portion that was like, if you'd like to explain anything on your application as far as like grades or like test scores, etc. I took that to kind of turn it into a strength at that point, where I explained away like this original like low biology score. I think I got like a C minus, which is it's like barely it's so close to not passing. Um, and I explained it. I was like brought it into the context of the package I was trying to give them, the story that I'm kind of like there's different themes to different stories you can kind of bring across, and my story was, I mean, it's weird to say it out loud, but kind of like a redemption story. I was like pushed down, and then but look at me now. Like I retook this class, I did really well. I did the MCAT, and then my biology score was like the top score when you break down the MCAT. Like so, and then in that I talked about a little bit briefly the context of the prior MCAT, which was um, my mother passing, which it's definitely it's not something unheard of for applications um in the medical field.
And that's you're the second person to bring this up, which is that on applications for different schools, a lot of the times they have these sections that say, "Is there anything else that you want us to know?" Essentially, they may word it differently, but the essence of the question is, "What should we know about your application that we haven't already asked?" And taking that opportunity to explain situations to build a more cohesive story as to why you have certain grades or why your application looks the way that it does. So I'm glad you brought that up because yeah, you're the second person now to say like that's what I did to explain the situations that I was in. Um, and so I think that's a really powerful tool to utilize when given the option on your applications. So Devin, so now you've taken the MCAT. How many schools have you applied to now that you're graduated from Berkeley? You have your GPA. You have your MCAT score. How many schools did you apply to, and how many did you get into?
Yeah, I applied fairly broadly. I remember there's like between 40 and 50 schools. I'm not sure if the average has gone up. Generally, every couple of years, they add 5 more schools that you should be applying to as everything gets more competitive. And I applied to those. The ones that you meet the cutoff, they send you a secondary application. which you pay them the privilege of completing that application. It's like between 50 and $100, and oftentimes you'll send them additional information like essays. So I think I received, it was somewhere between 12 and 15 secondaries. Um, and some of them are automatic, where it doesn't really matter. They use it as a revenue generating procedure. Uh, but if you get a secondary, you want to fill it out. It's because it's the only way you can potentially get an interview and then an acceptance. I was given 3 interviews, and was put on the wait list for 2 of them. And then I was given the acceptance to 1, and then I told the other wait list that I was happy because it was my of those, it was my number 1 choice that gave me the acceptance.
Wow. So going from around 50 applications to 3 interviews and to one school acceptance, obviously. But I mean, that I
Yeah.
think is pretty the numbers on that, right? If you
Yeah.
you actually might know this off the top of your head, but what is the acceptance rate into med school based, just from application into med school? Is it like 11% or something?
I have no idea. I'm gonna look it up. I couldn't even tell you.
I
I mean, it depends. Like, there's the per school acceptance rate
right.
versus like the overall.
I
And
want to.
every per school is incredibly low.
I think I want to say this is for those who are looking at whether or not they're competitive for med school, right? I think for my school, I went to Samuel Merritt, and I believe the acceptance rate into Samuel Merritt was 16 or 15%. I'd have to look it up, but I think it wasn't. It isn't as hard as the point I'm making is it's not as hard to get into a physical therapy school as it is to get into a med school. Med school is very hard to get into.
Yeah, and it's getting harder to get into as well.
Yeah.
So it takes a lot of luck. But I mean, you don't have to have a perfect application to get in.
Yeah. Um, So, in hindsight, of now we have your entire undergrad experience, including all of, like the different extra clinical experiences that you've done. Is there anything that you would have done differently if you can go back and do it again?
I don't know, actually. I um I reflect on how experiences change me as a person and what I should do differently in the future. But without a lot of my experiences to reflect upon, I wouldn't have the opportunity to better myself. So, are we saying that I would go back in time with the knowledge that I have now and just do things over a second time?
Right. Yeah. Yeah. So, like essentially the essence is like if you could recommend to someone to do something, right? Like what would that be?
Right. I mean, my recommendation is really don't count yourself out, even if you feel like your application kind of sucks. Because you can just start like the second half of college or later even and start preparing the application. Um, just look up online the general required things that come with whatever profession you're trying to go into. For instance, for medical school, you need like a certain number of hours shadowing. You generally want a research experience, um, and a number of clinical hours, etc. But there's a lot of variability. For me, I to get that research experience, I just looked up various departments in my school and sent mass emails. I'd look up a researcher and be like, I really liked your paper on blah blah that I just read about. I'd like to, if there's any project available, I'd like to work on it. None of that worked. But one of those researchers told their friend or told a fellow researcher that this kid was trying to get into research, and that worked. It was just like putting myself out there got my name out there to get a research experience.
Right. So
Um,
it's like there's a level of separation from you actually sending out the emails to people, but just you putting yourself out there allowed um, these other people to kind of get to know your name, right? And which led to a research experience. That's really
Exactly. It didn't even matter what I said, really, as long as I was being polite and showing interest. I couldn't really go wrong. It was just letting them know that I wanted to give them free labor. Um,
right. Yeah,
I
I'm
mean,
sure they
like
appreciate that.
you have that resource to give, and if you don't, then um, it's harder. But you should try and figure out a way to leverage loans or some way to create the opportunity for you to do um, the things that you need to do
Yeah,
to get those baseline check boxes done uh,
yeah.
for any sort of application.
Yeah, so encapsulating that, it seems like a really good message and a consistent one that I'm hearing from a lot of people that we've interviewed so far is that don't give up. Just because one thing goes wrong doesn't mean the whole thing's, over with. Just keep working on it. It's, especially considering that schools want to see how you're improving yourself. So I really like that message. It's a good message and one for everyone to really consider when you're going into your application season.
I will say one more thing. I know that some schools they assign points to applications based on certain metrics, including for medical school. I won't get into the specifics, but I'm on the committee that ranks applications for new applicants, and then and a lot of schools have the exact same kind of scenario where they'll have base totals of points where uh, they can stratify different applicants based on the things that we all know about, like the entrance exam, like GPA, uh, clinical experiences. Do they have like a certain number of them? Um, and for some schools, having a positive trend is worth more points than having an even trend. So even if your GPA is low, having a positive trend on the GPA is impactful.
Yeah, and when you say a positive trend, you mean someone who's like reapplying the next year to show that they've made some sort of progress on their application.
Yeah, let's say that your sophomore year of college didn't go very well, and you got like three C's or two C's and two B's and an A, whatever. Um, and then like you're like, man, I'm out for good. That it's not the case. Um, as long as you put in the effort and you show consistent upward trend of GPA, despite like that maybe tanking your overall GPA, having the trend going upward, even including postbacks or or community college classes following undergrad, if those are consistently high, it shows a continued commitment, even following that maybe a misstep.
That's good. Yeah, I feel like we just got some insider trader secrets here. So that's a very good note for everyone to write down in their books is, yeah, show the positive trend. Because that's really what they want to see, right? They want to see that you're trying to make yourself a better applicant. They want to see someone who's really going to work hard. Because med school is not easy, and nor is physical therapy school. Graduate programs in general, they're very hard. It's no joke. So it's we're laughing, but we're crying on the inside.
Yeah.
So and of course the schools want to make sure that you're not going to fall out of the program once they let you in, because that's one spot that is taken from someone else who would have otherwise been a good student. So. Um, Devin, so now that you're let's talk. So now you're in med school. Has your change or has your view, I guess, of what you've spoken about psychology? Has your view changed about what pathway you want to go into? And for those who don't know, maybe explain a little bit about what med school is, and then residency, and then what that whole trajectory looks like for a med student.
Yeah, sure. So medical school consists of 4 years, followed by residency. The first 2 years of that first 4 years are generally in the classroom. We're like book learning with very little clinical experience, although certain curriculums have it integrated. UC Davis, we have student-run clinics where most of the students, I'd say maybe like 80% to 90%, will go into these student-run clinics and on a weekend, like a Saturday or something, and get a little bit of clinical experience alongside learning about like subject based, like cardiology, like pulmonology, GI, etc. The third and fourth year are almost entirely in the hospital or community practice. So it's split based on different rotations in medical school. So there's core rotations that every medical student is required to complete, and these include like the standard things like family medicine, but they also every medical student that graduates is required to have had a rotation in surgery and delivering babies.
Right.
Uh, and these are skills that are generally associated with any physician should be able to do this in a emergency situation. Maybe not a surgery, but at least deliver a baby, things like that, or clean a wound and like maybe perform basic suturing. Um, so we go through these different rotations in different places and are exposed to different specialties, but we're not exposed to every specialty. There's quite a few that we never really get a whole lot of exposure to, and physicians end up finding themselves in those specialties despite this.
Right.
And this is primarily because the fourth year there's a little bit of leeway where you're allowed to choose certain rotations. Let's say you're like, I don't know much about rheumatology, but I'd like to know if that's something I'd like. I like to learn about immunology, and then you take a rheumatology course and see if that.
Resonates with you as a provider.
Yeah,
Yeah.
exactly. So I'm myself in my fourth year. Um, I'm actually during. Uh, Currently, I'm not in a rotation. I'm in a very short block of time, which is dedicated to studying for my second licensing exam. There's three licensing exams, and it's just you're always tested every level. It never goes away, but um, it's not too bad. After this, I pretty soon actually in the next month or two, I'll have submitted my applications to the next stage, which is residency. And right now I'm at UC Davis, but I'll go to residency. Could be anywhere really. There's various community hospitals. UC Davis also has a residency, but also anywhere really. And I would choose what I'm going to be applying is psychiatry. I love psychiatry. At least I love my rotations. I enjoyed a lot of my rotations though, and it's a really hard decision, and I'm still kind of grappling with that myself, despite it being so close. Um, Especially with my kind of motto, or else like kind of like lifelong idea that I want to keep my options open. That's come to an end where I
Right.
really have to choose a specialty. You can't graduate without being a specialist or a family practice doctor or internal medicine, which is also a specialty.
Yeah. So a lot of interesting things, and I want to come back to what made you choose psychiatry over any of the other professions. But I want to take a step back and just kind of highlight the process difference, or what it's like in grad school for physical therapy versus med school. So, 4 years of med school, licensing exams. It's not, you have three of them, and then after that you start your residency, which is working under the you work.
We do two, and
Yeah.
then during residency we do a third licensing exam.
Okay, okay. So the third licensing exam in residency, and then you work under the attending while you're at your residency, and then the residency itself, the length can change depending on the type of residency, right? Because
Yeah,
yeah, and so then so to compare that to physical therapy, 3 years of grad school, very similar in the sense that the first year is pretty much all your courses with maybe a very light clinical experience sprinkled in, and then second, third year, that's when you're getting a lot more of your clinical experience, and then you end with a 16-week, depending on the type of school. Schools are different, but 16 to 22-week experience of just straight working in a clinic. Then of which you take your licensing exam. So only one licensing exam, 3 years, and then you start working or applying for different programs. There are residencies in physical therapy that are specialty specific, so you can go into musculoskeletal or neuro or geriatric. It just depends on what your interests are, but they're not mandatory. The difference between PT school and med school mandatory, residency, PT school optional, pay and join these programs after you've graduated from your PT program. So Devin, so you're saying, despite your characteristic of wanting to have everything possible open to you, and now you're having to choose, one. We've kind of spoken about this before, outside of the context of this interview session, but can you tell me a little bit about what made you choose psychiatric versus maybe going into uh, like a surgical or any other ENT, like any other type of profession?
Yeah, sure. So, I mean, in undergrad, I was a psychology major, and I thought of myself at that point as going towards medicine, but really, like I might have diverged to psychology, going into masters to become a psychologist because I like communicating with people, I like talking with people, very social person, as you know, and I like that psychiatry has the ability to utilize speaking to someone and talk is a therapeutic technique to change people's ideas and behaviors for the better, alongside pharmacological intervention. Uh, Having the ability to do both is something that is very unique to psychiatry. Um, and then in that residency, they teach you to do different types of therapies as well, like psychodynamic and cognitive behavioral. If is and there are like there's more things you can do. You can specialize even further down that route. And a lot of practices they either do some of it, a lot of it, or none of it. It's really up to the practitioner. There's a lot of variability in psychiatry. You can have your own private practice. You can work in a hospital, um, kind of going around like seeing other hospitalized patients that might have come in with COPD or heart like a heart failure exacerbation, but they might be having a psychiatric symptomatology, and then that team would then ask the psychiatrist to kind of take a look and see if there's anything that would help or like kind of like what's going on here. So you can work in that setting. The kind of direction that we're going towards right now with telemedicine um, makes certain specialties much more interesting and valuable. Um, Valuable in the sense that like your ability to work is not hindered. Psychiatry is one where doing telemedicine is a distinct possibility,
Yeah,
especially if you're using your voice to kind of communicate ideas. That doesn't go away over a medium that's online, rather
yeah,
than in person with like for instance surgery. Like certain surgeons are having a tough time if their hospitals aren't allowing elective procedures, for
right,
instance,
right,
which is like all of orthopedic surgery, for instance,
yeah,
um, and a lot of oncology. A lot of cancers are not growing fast enough to be considered like an emergency kind of thing, and they're considered elective.
wow,
That's a whole nother discussion I don't want to get
yeah,
into. But having being in this situation right now during COVID, while thinking about my future and what possibilities, like whether the possibility of a pandemic in the future, like what I would like to do, it's important, and it's affected my decision somewhat. But I just generally like the subject. I like
yeah.
talking about it.
Well, knowing you for as long as I have, I think you've always been really consistent about what it is that you wanted to do, and of course, you've always entertained other ideas, and you've never committed to one thing or another. But one thing that we spoke about, which is actually, if you go back and watch the second episode, Joanna really spoke to the work-life balance of what it takes to be a physician working in different capacities and med school really, and that being one of the determining factors for her about maybe physical therapy is a little better because you can manage your work life much easier. So, and that's something we spoke about that was something you were interested in as well as the work life balance as working as a psychiatrist versus one of the other residency programs.
Yeah, that's absolutely right. Uh, Out of all the specialties that care about your mental health as a practitioner, psychiatry is number one. They're pretty committed to reducing burnout in professions, and they seemingly understand the need for taking time off at different times, and really creating a nice environment for people to work in. It's nice to know that, like, going forward, I'll probably be in a place where they care about me is in my mental well-being and as a person, versus some of the other specialties, it hasn't caught up yet. It's still like making its way. um for instance, surgery, it's not there yet.
Yeah.
Even though I really enjoyed my surgery rotations, I did very well on surgery, and I'm very dexterous. I like doing things with my hands, and I considered surgery as well, because I think I would be pretty good at it. But it didn't grab me the way the psychiatry does.
Yeah, and that's a good point. When you're looking at these different programs, and you're considering, well, maybe do I do PT, PA, nurse practitioner, physician? Really, do your research on what that job actually demands of you, right? And in this case, Devon's he's looking for something that's more balanced, right? Uh, and for someone else, maybe working 18-hour days is like, yeah, of course, I'd love to do that. I'd love to just do surgeries, and but that's not for everyone. And just knowing that before you go into it, so it doesn't catch you off guard, is an important point. So Devon, do you have any resources? I know you brought up the student doctor network earlier when we were talking about seeing if you're competitive. Is there any other resources that you used to kind of navigate med school, either during or before getting into Davis?
Yeah, there's quite a few resources, actually. Getting into medical school, um, there I guess I don't have it here, but there's various podcasts that help with getting in. Um, let me think about that for a second.
Yeah, I can
And talk about
speak.
the process for applying.
Yeah, I could speak to physical therapy. Obviously there's the student doctor network. That's what I used to compare my scores, my stats, which is my GPA, my GRE, and comparing it to other people who got into programs to see if I was even competitive. I also used Reddit a lot. There's a lot of subreddits out there, both for just grad school, school specific, program specific, so PA, PT, um, med school, and so using all of those type of mediums to really absorb as much information as I could to see where do I stand on applying. And of course, like Devin said, podcasts. Just listening. If you go and you search, like, I'm sure there's, if you just applying to med school, podcasts.
Found it. It's a medical school headquarters
Hmm.
with Dr. Ryan Gray. It's so good. They have so many episodes. They walk you through the process of applying. I used it extensively, um, mainly because I was a couple years out from undergrad. If I was still in undergrad, I would have probably used my career center, the UC Berkeley Career Center, that they can kind of guide you through the application process, what you need to do for interviews, like whether you should send like a thank you letter, things like that you might not exactly know about, but that are pretty essential. Um, Reddit, of course, is great for finding other resources, kind of like an intermediary where people will post things. Student Doctor Network is okay. They have there's a lot of information. A lot of it's wrong. A lot of it's very cutthroat on Student Doctor Network, um, but it has its place.
I know.
And
I will say, I was talking to a friend about the student doctor network in particular, and they were saying, because like if you go on there and you look at the stats, it's like, what the heck? These people, like, how'd they have a life? Just 4.0s across the board. All these, like, I went to a different country and like worked as a volunteer, like building huts and providing medical care. And so you're thinking, like, how am
yeah,
I even like considered in the running with these people? But he also, my friend pointed out to me that if you're the type of person that did all that stuff, like, it's the extremes, right? Like, the extreme is going to go on there and post their stats, and so you're looking at like a very small sliver of the people that got in. So just keep that in mind. So
yeah, absolutely. Yeah, and people embellish online when there's no one to check. But yeah, I mean, even if the average is like like X, you can be almost like a standard deviation below the average, and like you'll see that people still get in with like lower scores on certain things. Um, so I would not count yourself out if
Yeah.
you're a little bit low on something.
Yeah. So, man, so much to unpack during this interview. You know, it's funny. This interview is doubled the length of all the other ones so far. But the
Yeah,
funny thing is, I feel like there was still so much left on the table that we didn't really dive into.
yeah,
There's so much to still, I think, unpack. But I think we should maybe save this for another one. We consider another interview down the road.
yeah.
Per-
I would love to come back. There's so much we can talk about.
yes,
I
so many
know.
more specifics we can dive into. And I think what might help dictate that is, after this video is up, we'll see what the comments are, and of course, if there's like a thread of questions that seems to be consistent, like, well, you guys didn't really go into detail about this, or we missed information about that. Yeah, I would love to do another one with you because this is, I feel like, just a very dense but also information wealthy interview. So
Yeah, there's so much to know. It's really helpful to have resources to look at.
yeah. All right, Devon. So thank you so much for your time for coming on here. I know it was longer than we expected, but I feel like this was great.
Yeah, well, thank you for having me.
Of
I'd
course.
love to come back.
Of course. All right, Devon. Hey, you take care, okay?
Take care.